Physician-assisted suicide, PAS, is defined as a doctor or medical professional assisting a patient in committing suicide at the patient's request, especially if previously diagnosed with a terminal illness. PAS is illegal in most of the world, but there are a few states and countries that have legalized it, with strict limitations. PAS is a highly controversial topic, with strong supporters as well as those who are staunchly opposed. Those who are opposed feel that palliative care and religious practices are the only acceptable means of dealing with the pain of a terminal illness. Medical professionals take on a tremendous liability when they practice PAS. Physician-assisted suicide is an unacceptable end-of-life option that creates legal peril for doctors faced with increasing numbers of older patients who have diminished capacity due to their terminal illness, which drives them to seek PAS, despite having alternative methods of pain relief available. In this diagram, the red represents the states that allow PAS, the green represents the states that have laws against PAS, the blue represents the states that have pre-1997 bans on PAS, the orange represents the state that has court-decided PAS, and the gray represents the states that have no policy or law. In this diagram of Europe, the red represents the countries where PAS is punishable. The orange represents the countries where PAS is partially punishable. The green represents the countries where PAS is not punishable, and the gray represents the countries that have no policy or law. As you can see from these diagrams, some places allow PAS, but most are against PAS. PAS is not legal everywhere in the world, and governing ordinances differ considerably. For example, in Switzerland, PAS is legal and only considered a crime and open to prosecution if selfish interests are involved. In Austria, however, PAS is illegal due to their belief that life is an inalienable right and legally protected, even with the express will of the person concerned, providing any help to end someone's life, as well as active assistance to commit suicide, is punishable by law. To avoid prosecution, doctors who legally carry out PAS must carefully consider the drugs provided, a patient's mental state, any corrupt interests of family members, and even the doctor's own mental state. In a study of Austrian physicians' feelings towards PAS, almost half of Austrian physicians surveyed, 47.6%, felt the legal situation was ambiguous, and 21.4% felt that they had not been adequately trained to deal with patients at the end of their lives. And almost 50% of the physicians that participated felt legally insecure when treating end-of-life patients. The baby boomer generation, ages 58 to 76, are the most frequent requesters of PAS. As the population of baby boomers grows older, an increase in PAS requests is expected. Because the baby boomer generation has experienced major societal and religious changes during their lifetime, they have developed a strong sense of self-determination. This self-determination has empowered them to make their own end-of-life decisions. There are several forms of terminal illness associated with the requests for PAS, but the disease most often associated with requests is terminal cancer. In the study of Austrian physicians' feelings towards PAS, 53.1% of all patients involved in the study died of cancer, and 41.4% of those physicians surveyed had been asked for PAS in the past, with hemato-oncologists being asked statistically significantly more often than the other physician groups. Patients feel that they can no longer suffer with terminal illness, or that they are a burden to their families mentally and financially. Alternative coping mechanisms and care for patients with terminal illness who have requested PAS include engaging in religious practices like meditation and prayer, and palliative care. Religion can give those who are sick hope that they can push through their illness or pass on into an afterlife where they will no longer be suffering. In a study on religious values in relation to PAS requests and the baby boomer generation, it was found that older adults who gave more importance to religious values in their daily life seemed more likely to disagree with PAS for themselves. And 40% of older patients spontaneously stated that their faith enabled them to cope with the stress of medical illness. Palliative care is an alternative option that provides relief from the symptoms of illness and includes specialized medical care for people living with a serious illness, such as cancer or heart failure. Among palliativists, 26.3% would accept PAS, 55.3% would not accept PAS, and 18.4% were undecided. The opposing argument is that PAS should be legalized and is the right choice for those with terminal illnesses because they do not have the time or the strength to find another option to survive. According to a survey of the Croatian public, approximately 75.9% of participants agreed with PAS. Although the overall majority of participants in this study agreed with PAS, this 2022 study presented an interesting point. A significant percentage of the younger population supports PAS, despite not having endured a terminal sickness themselves. The average age in this study was 48.21 years old, far younger than the age of those who most often request PAS, the baby boomers, ages 58 to 76. PAS is an unethical process that needs to be stopped and replaced with more effective, life-extending treatment options. The world's population will continue to get older, which will lead to more requests for PAS due to terminal illnesses such as cancer. Because of this, lawful parameters will need to be set to ensure legal security for doctors and patients' families. In lieu of PAS, the medical industry should focus on the use of palliative care services. Patients should be encouraged to consider the fact that religious practices, such as prayer or meditation, can reduce the frequency of requests for PAS.